Okay, welcome everybody. This is Chelsea with BirthFit Kansas City. The doc is in. I'm here with Dr. Lindsay, and she is going to tell us all about herself. So yeah, tell us just who you are and what makes you special.
I'm Lindsay Wilson, as she said. I am now the owner of Locale Chiropractic. It's a house call chiropractic service for all the local moms in the Kansas City community. I'm really reaching out for pregnancy and pediatrics because that's my pure passion when it comes to chiropractic care. Yeah, that's about it.
Yeah. What led you to Kansas City? Like, why are you here? You're not originally from here. We are actually from like the same community.
Yep, we're really close. I'm for half an hour apart. I'm from Newton, Iowa originally. I did my undergrad in biology, biomed with chemistry and public health minors, and so it was actually fate that really brought me to chiropractic and to Kansas City. I'd been going to the chiropractor since I was in high school for headaches or other just random things that would go wrong. And I had a friend randomly moving to Kansas City, and so I said, "Oh, I'll come along and help you choose an apartment." And we drove past Cleveland Chiropractic, and that was it. Like, I just knew that's what I needed to do, and so Cleveland Chiropractic is actually what brought me to Kansas City. I started practicing in Omaha for about 2 years, and I just couldn't shake KC. So I came back, and I'm so happy and so blessed to be back in the Kansas City area. I just love it.
Yeah. What do you love about Kansas City? What do you love about treating the moms of Kansas City area?
Well, I love Kansas City mostly because of sports, let's be honest. I need big sports teams. I love the community. I love how people are so nice here. Seriously, like, it feels like a small city, but it's a bigger city. And so it still allows me to do all the things in my day-to-day, like being able to treat the locals, but then being able to really connect with people, because even though it's so big, it's really nice to be able to connect with so many people, whether that be OBs or doulas or other groups or other chiropractors. I feel like it's a really small feeling when it comes to community and being able to connect and such.
Yeah, it's this big city, but you run into people
that you know
all the time. Like, the health and wellness world is pretty small here in Kansas City,
connected.
So you could go to a coffee shop and you're going to run into at least 2 people you know.
Exactly.
So that's really lovely. What do you love about treating moms and babies and pregnant women in the community?
What I love most is education. So having a mom come in and having no idea what chiropractic can do in general between the nervous system and all that stuff, but then also educating on like breech babies and how much chiropractic can help with helping a baby have the space that they need to turn, how chiropractic can help an easier birth because of the motion that you allow to increase. So if you've got like a stuck sacrum or a stuck lower back joint, and it's not allowing you to open up, like, you're not going to have an easiest birth. So my job is just to educate women on how much chiropractic can help not only pain, but really baby position, comfortability, and then ease with birth.
Yeah.
And I just love when the light bulbs go off on moms. They're like, "Oh my God, I had no idea," and it's just so amazing to educate.
Yeah, and a lot of women are afraid, I feel like, to go to a chiropractor, especially when you're pregnant, because you're kind of afraid of everything. Everything.
Yep.
What you put in your mouth, like what you smell, and so, you know, that they are afraid to come, but once they do it, they're like, "Oh my God, why?
Yeah, and then there's the other thing is, you know, I like a lot of research. That's my thing. I love research. And so I always urge moms to more research on these things. ICPA is the International Chiropractic Pediatric Association. And if you go to their website, they have a lot of, case studies, which are not the most reputable sources, but case studies of tons of moms and pediatric patients getting care through chiropractic, and they have no idea, like, whether that be enuresis or whether that be baby positioning or whether that be latching issues and stuff like that. Like, I just love seeing the research behind it and showing that this does happen across the world or across the United States.
And then it helps.
And it helps. And then, like, the minimal side effects, the minimal side effects, if any, you know?
Right. I mean, the side effects are positive.
Exactly.
Like, I said it on an interview before, like, my first son, when he was little, he would not latch at all, and he would not sleep through the night very well, and so I tried everything, and eventually it was like, the last thing on my list was to go to a chiropractor. Like, I was resisting that because my previous profession was like, chiropractors are just uneducated quacks, and I'm like, I mean, I don't even know why we're told that, but so we went, and literally the first time he got adjusted that night, he slept 12 hours, and he was a completely different baby, and so it was like tears of joy and like completely forever sold, and just like belief and preach about just the greatness of chiropractic.
And how something so simple, just even just really light touches on a pediatric patient can like make a world of difference. I've had pediatric patients mostly for ear infections as well as colic, but then a lot of constipation and earaches are the ones that I deal with the most. And for moms to come in and say, my child's been on 4 rounds of antibiotics in the last 6 months, and they come and see me regularly for about 1 to 2 months, and they don't have another one. I mean, it's just like, it's crazy. And then like teaching them about the side effects of the antibiotics on their digestive tract and all of those things, and probiotics being so important to reestablish that environment for them, and how it can affect their outcome in later parts of their life when it comes to diabetes and all those other things. I just, like I said, I love education, so I love seeing the change, knowing that I get high fives when bowel movements occur. It's pretty impactful when you actually have pediatric patients come in with major significant changes.
This little guy was just in his first week.
That's what we love.
Yes.
That's what we love.
He's our little singer down here. He's our serenade for you kind of touched on this, but what specifically led you down a path of chiropractic? Why were you like going pre-med first, and you figured out like, oh my God, I'm just going to be like continuing the sickness of the United States, or what was it that like sparked chiropractic here?
So I didn't even know that I was going to be a chiropractor. I went, like I said, in high school for a headache that I couldn't get rid of, and I knew growing up, my mom was a nurse. I didn't really like medications. I hate taking pills. I still can't take pills. And so when she took me to the chiropractor, he didn't tell me what he was doing. I had no idea what was going on, and he just completely changed my whole world by just adjusting me, and I walk out without a headache. Like, it was crazy to me, but it never clicked. And then I went to college, and anytime something would go wrong, I literally remember episodes of, like, waking up with my hands going numb or tingling. And I was like, well, I don't know what's going on. I'll just go to my chiropractor. And like 2 visits later, it was gone again. I mean, it was crazy. These like impact things, but they never explained chiropractic to me. And so, yes, I went the biology route, the biomedical route, so that way I could do whatever kind of things. I wanted to be some type of doctor, but I knew that the traditional route of medicine was not for me. It wasn't what I was supposed to do. And so I looked into things like nutritionists, or I looked into things like optometry and stuff, things that were like not so heavily focused on medicine, but none of them really got me excited. And so that's when the fate intervened, and I drove past the chiropractic, and this huge light bulb just went off, and it was like, that's your calling, that's it. Then that's it. That's it. That's what really led me to chiropractic, and I know that it was the right choice for me. I know that I love chiropractic and what it can do, and I love seeing the results on a daily basis. Yeah.
It's so great when we stop and listen. Like, the universe is talking to us all the time, but we are just so busy, and we're trying to like force things. Like, I'm gonna make this work. And if we just stop and release, and like we have those aha moments, and it leads down to like this beautiful,
the most amazing thing.
So kind of like going along that line, like just listening to the universe and holding space. Like, you are taking care of patients every day, all day. How do you take care of yourself? Like, how do you practice self-care?
I would say actually more of my self-care has come about even in this last year for working for Lululemon, which you know as well. Lululemon's really taught me, or really led me towards yoga, really led me towards meditation. Everyone there exercises and eats right, and all of that good jazz. That really does lead to self-care. I mean, that's what it's all about. So I guess my self-care is through yoga, meditation. I got a meditation series on my phone right now. And then just having a really strong sense of work-life balance and trying to make that happen. Trying to focus on that.
How do you do that? How do you balance?
At this time, it's not balanced. At this time, it's more work than not. But that's where I'm going towards with Locale Chiropractic. I mean, it's going towards a work-life balance.
tell us a little bit more about Locale. Like, what's the mission behind it? Like, what are your goals with it, so that moms in KC know?
Yeah, so Locale Chiropractic is literally all about convenience and getting chiropractic care to the moms. I can't even imagine having to bundle up 2 or 3 kids and put their coats on and make sure everyone's had a bathroom break and make sure that you've got snacks and you've got this and that, and then you've got crying kids in the car because some of them don't like car seats. And sometimes it's a little rough to get across town. And so what I'm trying to do is just bring affordable, convenient care to the moms and the pediatric patients, so you don't have to do all that just to have a 20-minute appointment. I'm also trying to bring quality care to these patients because they're just like any kind of medicine or any type of service. There's a range of what is quality, and I spend a good amount of time with my patients. I'm always spending between 15 and 20 minutes with each and every single patient, and so I'm trying to bring quality into that. Like I said before, I love research, so I'm trying to bring research into it. I'm trying to bring my expertise with continuing education. So I am doing the ICPA series, and then I'm also, I've also taken courses with NPI and such. But then my other specialties are active release technique, which not a lot of chiropractors that treat moms and babies are educated in or do or practice. So active release technique is all about the soft tissue, which with relaxin and all of those things and changes going on with pregnancy, I have really, really great, I feel, response from moms that even if I've been to other chiropractors and they say, this is just so different than even the chiropractors I went to, and it's because I'm using active release technique or A.R.T, and especially focusing on psoas or different muscles in the glutes, different muscles on the front side of the pelvis. They just see just completely different results maybe than even other chiropractic offices may be able to have. And there's a different need for every single mom, and so I'm just trying to get out that. I'm just trying to get out that stuff, to the moms. And so that's what it's about. It's about rounding out a lot of different techniques that are normally paired with pregnancy and pediatrics, and pairing them with pregnancy and pediatrics, as well as, like I said, the convenience and the affordability.
So you're gonna do in-home?
In-home, it's house call. So I do offer services at my own apartment, and that's always an option if that's needed. But it's really about convenience for the mom.
Oh my gosh, let me tell you what. To not have to lug around 2 kids, and car seat, and drive across town or anywhere, and just have somebody
show up at your
knowing
door
that you're coming, or like home births, or even just you labor at home before you go to a birth center or to the hospital. So to have somebody that is gonna, it's not like asking a favor for them to come to your house. Like that's just what you're gonna do.
That's my job. That's what I do.
Yay. Let's see. What about so tell us a little bit more about meditation. You said you have something on your app. Like, how do you practice mindfulness? Like, really, we try to focus on that with BirthFit. One of our pillars is mindset. So how do you practice it yourself, and how do you encourage your patients to do so?
As far as myself, I'm pretty lax. I just, what everyone calls me that day, that's what I do. I don't have any set limits because I believe in a lot of moderation for anything in your life. And so it's not like I have to meditate every day, but I do make sure that I download new meditations all the time, just in case I need them or want them there. That's really mostly it for me. I'm not educated on hypnobirthing. I'm not educated on those types of practices, but I encourage moms definitely to get involved with all kinds of mindful groups, such as like the natural birthing groups, Birth Without Fear, hypnobirthing. I really encourage moms to look into doulas, things that are really going to support them mentally during the process of pregnancy, birth, and postpartum care, because it's a huge mental thing, right? If you believe you can do it, you should, and if you don't believe you can do it, you can't. And that comes to patients with even pain. If patients don't believe that they want to get better, or they don't think they're going to get better, they've been told by this many medical doctors that they're going to have the pain for the rest of their life, a lot of them believe that, and then that's what ends up being the reality. So it's a huge thing to lead them towards other resources that do focus on mental.
I would say labor is like 90% mental. Totally. I mean, it's difficult, but if you can get yourself in the right mindset beforehand, then your outcome is going to be just that much better, smoother, easier.
Yeah.
Everything.
Yeah.
What would be 3 words of advice that you would give somebody who wants to go down a similar path as you professionally?
Oh, so like a pregnancy pediatrics?
Yeah.
Yeah. One I think would be to not limit the techniques. If they're already a chiropractor and they're looking to go towards this, not to limit your techniques. Like I said, my I think specialty or my like niche besides being a house call service is that I practice things that are more associated with sports or more associated with like soft tissue stuff. And so while the ICPA seminars is amazing and that's how most moms will look and find pregnancy and pediatric chiropractors, all of these other techniques such as like McKinsey, DNS, which is really enveloped or really supported by BirthFit. That's DNS is not like a birthing naturally when people think about DNS, it's not like, oh, pregnancy. Yeah. It's not that. So what I really encourage someone that would want to go on this is just looking for those other techniques that aren't necessarily associated and being able to apply them towards pregnant moms because there's all different ways to treat. Yeah. And it's hard not to get, I think, stuck down that one tunnel that everyone else goes down. Mm-hmm. Yeah.
So keep that open mind.
Yeah. So 1, I guess open mind. 2 is I think probably just like really back yourself in research. Like you were saying, basically, like a lot of moms are scared of getting treated. But the fact is, the more you educate yourself, the more you can educate the moms on how actually safe and effective chiropractic care can be for these things. There's no reason to be fearful of getting treated while pregnant, and there's just so many benefits to it that moms just don't know about, whether that's improved nervous system function, that's actually going to be talking to the pelvis and talking to those muscles and talking to those organs and such during birth, to the actual joint range of motion, to the actual muscles, tendon, ligaments being, even and not so hypertonic and all of that good stuff, preventing scar tissue post-birth. Just like education, so being really educated yourself and really that. And then 3, I would just say being an advocate for chiropractic in general, as well as chiropractic for pregnancy. I think a lot of chiropractors would probably be a little bit more reserved, but I think in like the recent past or whatever, we're really becoming a lot more vocal about or advocating for chiropractic care during pregnancy because of like the research coming out. Yeah. So I guess it would be keep an open mind towards other techniques. It would be to educate yourself on research, and then 3 to be a really great advocate for chiropractic care during pregnancy. Don't shy away from the situations like, I don't know if I can fix enuresis on everyone, but you know what? It's a really good thing to try. Yeah, because the side effects are so few. Yeah.
Yeah. Mr. Smiley, he's loving you. I guess those kind of tie into maybe words of advice for a mom to be or a new mom is that, just reading some of the research, and if you don't understand it, because some of it is like huge words that that can be hard to decipher. So coming to a chiropractor and asking questions and not just being like, I can't read this, I've heard bad things, or the they out there is constantly not necessarily always for chiropractic care, because the medical world is so divided. It's we're not just like we can all help each other. I mean, like chiropractors and doulas, we're like there's room for everybody,
room for everyone.
But on the other side, it's sometimes not. So just doing research.
Yeah, I would say probably my 3 words for moms are to be educated. So like going to the International Cesarean Awareness Network and like learning about like what's a normal rate and what should I be expecting if I'm a low risk first time mother, and what are my options. If you don't know your options, you don't have an option.
Exactly.
You have to have your education. Just like we were discussing before about mentality, you have to be empowered. So it's education, it's empowerment. So being empowered to know that there are all kinds of resources out there for the moms, whether that's the natural birthing groups on Facebook that I invite my moms to, the International Cesarean Awareness Network groups that I invite moms to, hypnobirthing, Birth Without Fear, all of those things. So being empowered, reading Anna and Meg Haskin, like all of those great books, all of those things. So being empowered, and then again advocating, just knowing your rights. And knowing what you can and cannot say yes or no to, or the ability to get up and move around during birth, being your own advocate.
Yeah.
Mm-hmm.
Yeah. And hiring a doula.
And hiring a doula because, again, so amazing.
Yeah, exactly. Yeah. What would you say, just final thoughts, is like, how can people find you? Like, do you have Facebook or Instagram, or just how can we find you and contact you when the mom is ready or
Yeah. Yeah, so right now, being so fresh and so new, I am requesting that moms actually request or find me through my own phone number, which is 641-275-5336. But a website will be coming up any minute, and they'll be able to find out more about my techniques, as well as my education, as well as how my practice will work through a website.
Great. Yeah. Thanks. Thank you so much for
Thank
joining
you so
me.
much. Thank you for coming too.
He's ready to eat again. Like,
Yep.
it's been an hour. All right. Thank you.